Welcome to Health Planning, an executive discussion series from Abacus Insights focusing on the issues and opportunities facing payers today in this ever-changing healthcare environment. My name is Minal Patel, and it is my distinct pleasure to welcome Matt Mertel to today's conversation. Matt currently serves as Senior Vice President and Chief Operating Officer for Prime Therapeutics. Prime is a diversified pharmacy solutions company that, alongside its subsidiary Magellan Pharmacy Management, serves 1 in 6 Americans and processes over 600 million pharmacy transactions annually. Prime's stated goal is to be the #1 pharmacy solutions partner, simplifying the healthcare experience, making healthcare easier for all. Matt, welcome.
Hey, thank you so much for having me, Manal. I'm excited for this conversation.
Prime Therapeutics has changed a lot over the last several years. Can you tell our audience who Prime is today?
I think when people reflect on who Prime is, they think of a Blues-owned PBM, just solely focused on the Blues. Well, we are still Blues-owned, and that is very much true. We also, in addition to our 19 Blues clients, serve over 80 health plans, 7,000 plus employees. You mentioned the number of claims we process, handle about 60 to $70 billion worth of pharmacy transactions a year, all enabled by the latest technology. And so Prime is a very different player than we have been historically.
And what's driving this change in overall execution and ultimately mission as well?
A lot of it is our vision. I don't know about you, but being in the healthcare arena, every time any of my families or friends have an interaction with a healthcare company, a provider, a payer of some sort, and there's something complicated about that transaction, I get the call. I'm sure you experience that. I'm sure a lot of your audience experiences that. And then I try to assist and walk through and help our loved ones through those transactions to come to the most best viable outcome for their given health situation. And so Prime has simply adopted that vision. We want to be the nation's pharmacy partner of choice by providing the care that we want for our loved ones. And for us to get there, we really have had to undergo pretty monumental transformative steps to help us along that journey.
Pharmacy data is amongst the most valuable part of the information cycle in healthcare, not only because of its timely nature, but typically how specific it is in identifying someone's health or illness. With that, what role do you think the PBM has to play in overall delivering better value for its customers?
So while we have the very fast point of sale transaction, a uniform data model that shows us how the claim paid and standards that govern all of that, many times that data is locked up in systems that are pretty old. And so in this journey we're undertaking, we're taking a look at those systems and leveraging the benefit of that transaction, starting to extract it and serve it up to our members and our customers in a way that we've all grown to expect with Amazon and all the other services that we use today. Healthcare is, like, frankly, a little bit behind that. And we've got to take the advantage of that structured claim and then pair it, with modern systems to unlock the value of that data.
So as you modernize your technology, what are some of the challenges you face with your customers who may be on more legacy technologies in trying to achieve your ultimate mission?
Ideally, we foresee an environment where we're not sharing batch files, the mainstay of the industry that has been around forever, and we're actually running everything through modular APIs. That's going to be a little bit off. And so while we have a multi-year plan on to get there, in the short run, we're very much accommodating of flat files and the capabilities of the systems we interface with, because the ecosystem works today. It's not perfect. It has its flaws. For us to get to the next level and perform as a next-gen PBM and next-gen healthcare provider, we have to get to modern on-time APIs. And that starts with our core claims adjudication and access to our data.
You've been very public about the investments you're making in your core adjudication system. What investments are you making on your data side, in the data side of things?
In addition to taking the pharmacy data, which I mentioned comes to us in a structured, predictable format, we also see tremendous value in marrying that with medical claims data. And if you've been around medical claims data, you know it comes in wildly different formats. There isn't an industry standard that we can leverage like we have available to us on the pharmacy side. And so we have taken upon ourselves to build the data infrastructure with partners such as Abacus to help us build these data infrastructures to normalize this data and provide the equivalent of the pharmacy data model for medical claims payments.
And what advice would you give to your customers, the health plans, the government-sponsored organizations, large employers that can ultimately benefit from the investment that you're making?
I would give a bunch. I would start early. I think that these are multi-year investment cycles, and that these large mainstay systems that have supported us for many years in this industry are reaching the end of their useful age. And while it be a large project that will span multi-years and impact your organization, I suggest you get started. While you're in that transformative journey, a partner like Prime will be around and support legacy as well as new technologies to help you with your data transformation, unlock that data in the interim. I think, if anything, start early, have a multi-year plan, and just basically get going.
Matt, thank you for your insights and valuable suggestions for our audience today. I know they're going to find it valuable as they're embarking on their strategies to simplify healthcare. My name is Minal Patel. I thank our listeners, and hopefully you'll tune into the future episode.